The cruise brochure sat on the dining table between the mashed potatoes and green beans, glossy photos of tropical beaches and buffet spreads catching the light. My mother pushed it toward me with barely contained excitement. 10 days in the Caribbean. Your father and I have been planning this for months. We leave March 15th. I set down my fork carefully. Mom, my surgery is March 15th. Oh, that. She waved her hand dismissively. Can't you reschedule? It's just a little procedure. You've been putting it off for months anyway. What's a few more weeks? Just a little procedure. I was 32 years old and needed a full hysterectomy due to severe endometriosis that had progressed to stage 4. The disease had spread to my bowel and bladder. I'd been in debilitating pain for years, managing it with medications that barely worked while trying to maintain my career. My surgeon had finally gotten me scheduled with one of the best gynecological oncology teams in the state. It's not a little procedure, Mom. It's major abdominal surgery with a 6-week recovery. Stop being dramatic, Jessica. My mother's voice had that edge I knew too well, the one that said I was being difficult, inconvenient, attention-seeking. You've always exaggerated your health issues. Remember when you insisted you had appendicitis and it was just gas? I was 12 and it actually was appendicitis. I had emergency surgery. After you made such a fuss that we took you to 3 different doctors. She picked up the brochure. This cruise is non-refundable. We've already paid $8,000. Surely your little procedure can wait. My father cleared his throat. Your mother's right, Jess. We've been looking forward to this trip. You're young and healthy. You'll heal faster if you wait a few weeks. I've already scheduled time off work. The surgical team is booked months in advance. I can't just reschedule. Sure you can, Mom insisted. Call them tomorrow and push it back. Stop making a big deal about your little procedure. I looked at my mother. Linda Morrison, RN, BSN with 30 years of nursing experience. She'd spent 3 decades in healthcare, most recently as a charge nurse in the pediatric unit at St. Anne's Medical Center. She understood what major surgery entailed. She knew the difference between a little procedure and a total hysterectomy with bowel resection. She just didn't care. Not when it interfered with her vacation. What my mother didn't know, what I'd carefully kept from my family for the past 5 years, was exactly where I worked. She knew I had some hospital administration job that paid well. She assumed I was a mid-level manager somewhere handling paperwork and attending meetings. She had no idea I was the majority owner and CEO of Morrison Healthcare Group, a network of 7 hospitals across 3 states, including St. Anne's Medical Center where she worked. The hospital where she just applied for a promotion to nursing supervisor, an application currently sitting on my desk, awaiting final executive approval. I'm not rescheduling my surgery, I said quietly. Then I guess we won't be there to help you recover. Mom's voice was cold. You know what, Jessica? You've always been selfish. Always making everything about you. Well, go ahead and have your surgery. We're going on our cruise. And don't expect us to drop everything when you need help recovering from something you could have easily postponed. She stormed out. My father followed. I sat alone at the table staring at my untouched dinner, thinking about the application on my desk and what Monday morning would bring. The weekend passed in tense silence. On Monday morning I arrived at Morrison Healthcare Group headquarters at 7 a.m., took the private elevator to the executive floor, and walked into my corner office overlooking the city. My assistant Margaret was already at her desk. Morning, Ms. Morrison. Coffee's ready and your board packet is on your desk. The meeting starts at 9. Thanks, Margaret. The nursing supervisor applications from St. Anne's, are those finalized? Waiting on your approval. HR flagged one for your personal review. He handed me a folder. Linda Morrison. Apparently she's your mother. She is. Margaret's expression was carefully neutral. HR wanted to ensure there was no conflict of interest. They've noted her performance reviews are excellent. 30 years of service, strong clinical skills, good rapport with patients. I opened the folder. My mother's resume, her performance evaluations, her recommendation letters. Everything looked impressive. Linda Morrison was objectively an excellent nurse and a strong candidate for supervisor. Then I found the internal notes section, the part candidates never saw. Most of the peer reviews were positive. But there, buried in the comments from 3 months ago, was something that made me stop cold. A note from a nurse manager. Overheard RN Morrison telling a post-op hysterectomy patient to stop whining about pain levels. Patient was crying, asking for medication. RN Morrison told her she was being dramatic, and that women have hysterectomies every day without this much fuss. Patient filed formal complaint. RN Morrison completed refresher course on pain management communication. I read it 3 times. My mother had told a patient in pain, a woman recovering from the exact surgery I was about to have, that she was being dramatic. I picked up my phone and called Dr. Sarah Chin, my surgeon. Dr. Chin, it's Jessica Morrison. What's the typical pain level patients experience after hysterectomy with bowel resection? Significant. We're talking major abdominal surgery with multiple organ involvement in your case. Most patients rate their pain between 7 and 9 out of 10 for the first 72 hours, even with medication. It's absolutely not a minor procedure, Jessica. And if a nurse told a patient to stop whining about that pain? Silence. Then, that would be a serious breach of care standards. Why do you ask? Just preparing for what to expect. Thank you, Dr. Chin. I hung up and stared at my mother's application. Excellent nurse. Strong clinical skills. Good rapport with patients. Except when those patients were women in pain after major surgery. Except when those patients needed compassion instead of judgment. The board meeting started at 9 sharp. We moved through the agenda efficiently, financial reports, expansion plans, quality metrics. At 10:30 we reached internal promotions. Several nursing supervisor positions at St. Anne's, our chief nursing officer, Patricia Wells, announced. We have 5 candidates. 4 have been approved. 1 requires executive decision due to family relationship. Linda Morrison, the CEO's mother. Uncomfortable shifts around the table. Patricia continued carefully. Her qualifications are excellent. However, there's an incident report from 3 months ago regarding a post-op hysterectomy patient. Tell me about that incident, I said. Patricia pulled up the file. Patient was 48 hours post-op from an abdominal hysterectomy. She was crying, reporting pain level 8, requesting additional medication. RN Morrison told her to stop whining, said she was being dramatic, and suggested she was drug-seeking. The patient filed a complaint. RN Morrison received a verbal warning and completed a refresher course. What was my mother's explanation? She stated the patient had already received pain medication an hour prior. That in her professional judgment, the patient was exaggerating symptoms. I was quiet for a long moment. In 1 week, I'm having a total hysterectomy with bowel resection for stage 4 endometriosis. When I told my mother about this surgery, she called it a little procedure. She told me I was making a big deal out of something minor. She scheduled a vacation during my surgery date and told me to reschedule. When I refused, she called me selfish. The room was silent. My mother is a nurse who dismisses women's surgical pain as dramatic. Who calls major abdominal surgery little procedures. Who believes patients are drug-seeking when they report severe pain after having organs removed. I looked at Patricia. Is that the kind of person we want supervising our nursing staff? No, Patricia said quietly. It's not. Linda Morrison's application for nursing supervisor is denied. Furthermore, I want a full review of her patient interactions over the past year. If we find additional instances of dismissive care, we'll need to consider whether she should continue in patient-facing roles. Our chief medical officer leaned forward. Jessica, I understand this is personal, but it's not personal. It's professional. If my mother weren't my mother, if she were any other nurse who'd told a post-op patient to stop whining about pain, would you promote her to supervisor? No, he admitted. Then we're done here. Patricia, please inform RN Morrison that her application has been denied and that a formal review of her patient care standards will begin Monday. The meeting continued, but I barely heard the rest. My mother would know by end of day that she hadn't gotten the promotion. By Monday she'd know why. And she still wouldn't know the decision came from me. My mother called Tuesday morning at 6 a.m. shaking with rage. They denied my promotion. 30 years at that hospital and they denied me. Because of one complaint from a drug-seeking patient 3 months ago. They're doing a full review of my patient care standards. Do you know how humiliating this is? Mom, Maybe they have legitimate concerns about how you interact with patients in pain. I'm sick of people acting like every patient who wants narcotics is some tragic victim. That woman was fine. She'd had pain medication an hour before. She just had major abdominal surgery. It was a routine hysterectomy. A simple procedure. Women have them all the time without acting like they're dying. There was the same dismissive tone she'd used about my surgery. The same minimization. Is a hysterectomy a little procedure, too? I asked quietly. Like mine. That's different, she stopped. Wait. Are you saying, do you think this is related to your surgery? I think you have a pattern of dismissing women's surgical pain. Oh my God. You reported me, didn't you? My own daughter, sabotaging my career because I won't cancel a vacation. You reported yourself when you told a patient in pain to stop whining. I can't believe this. I'm being punished at work, humiliated in front of my colleagues, all because you can't handle that your parents have lives that don't revolve around you. I hope you enjoy your cruise, I said and hung up. She called back 17 times. I blocked her number. The surgery happened on schedule. Dr. Chen performed it flawlessly. 4 hours in the OR, total hysterectomy, bilateral salpingo-oophorectomy, excision of endometriosis from my bowel and bladder. When I woke up in recovery, the pain was exactly as intense as warned, a solid 8 out of 10 even with medication. A nurse adjusted my pain pump. You're doing great, Ms. Morrison. This is completely normal pain for what you've been through. Don't try to tough it out. We want you comfortable. Thank you, I whispered. Margaret, my assistant who'd volunteered as my support person, held my hand through pain spikes and never once told me I was being dramatic. On day 2, Patricia Wells stopped by. How are you feeling? Like someone removed several organs from my body. She smiled gently. That's accurate. You're healing well. She paused. The review of your mother's patient interactions is complete. We found 3 additional incidents over the past year of inappropriate pain management communication. All with female post-surgical patients. What happens now? She's been placed on administrative leave pending mandatory training. She'll need to complete courses in pain management and patient communication. She can return to patient care after that, but she won't be eligible for promotion for at least 2 years. She's filed a grievance claiming discrimination. She doesn't know you're the CO. Don't tell her. Let the grievance go through proper channels. I was discharged after 5 days. The pain was significant, worse than expected. I was grateful for every nurse who believed me, who treated me like a patient deserving of compassion. I thought about the woman my mother had dismissed. Whether she'd had anyone to advocate for her. My parents returned from their cruise 3 weeks later. My mother called from a blocked number. Jessica, we need to talk. I'm recovering from surgery. You've been recovering for 3 weeks. How long are you going to milk this? Milk this. As if recovery from major surgery was a performance. Goodbye, Mom. Wait. I'm sorry. About calling it a little procedure. Your father told me I was too harsh. So we're okay. I accept your apology. But we're not okay. Jessica, please. I lost the promotion because of one bad day with one difficult patient. This has been the worst month of my life and I need my daughter to be supportive. The worst month of her life. While I'd been recovering from surgery alone. Mom, I hope the training helps you become a better nurse. But I can't be your support system right now. Because I didn't cancel a cruise? Because when I told you I needed major surgery you called it a little procedure. Because you care more about your vacation than my health. Because even now, you're making this about your career instead of asking how I'm doing. Silence. How are you doing? She asked finally, her voice small. I'm healing. It's been hard. But I'm managing. I should have been there. Yes. You should have. 6 months later I returned to work full-time. My mother completed her training and returned to patient care, but her applications for supervisor positions remained denied. She never found out her daughter owned the hospital. But every time she logged into the staff portal she saw my name at the top. Jessica Morrison, CO Morrison Healthcare Group. She never made the connection. Or maybe she did and chose not to acknowledge it. My surgery wasn't a little procedure. My pain wasn't attention-seeking. And my mother's career stalled because she couldn't see the difference between compassion and dismissal. She called my surgery attention-seeking. She didn't know I owned the hospital. And by the time consequences arrived, it was already too late. I stood at the window of my office 1 year later watching the city below. My incision had healed to a thin white line. The endometriosis was gone. The pain that had ruled my life for years was finally manageable. My phone buzzed. A text from an unknown number. "This is Linda Morrison. I know now. I know you own the hospital. I know you made the decision. I'm so sorry, Jessica. For everything." I stared at the message for a long moment, then deleted it without responding. Some apologies come too late. Some bridges, once burned, can't be rebuilt with words alone. My mother had called my surgery attention-seeking while reviewing applications at the hospital I owned. She'd learned the truth. But the lesson had cost her everything she'd worked for. And I'd learned something too, that sometimes the people who should protect us are the ones we need protection from most. I turned back to my desk where a new stack of applications waited, including 3 from nurses my mother had supervised, all citing her dismissive attitude in their exit interviews. The pattern had been there all along. I'd just been too close to see it. Now from my office on the 40th floor I saw everything clearly. And I'd never let another patient be dismissed the way she'd dismissed me.